Hi everyone, my name is Dr. Mary Claire Haver and I am a board certified obstetrician gynecologist. I'm also the creator and founder of the Galveston Diet. I'm also a certified culinary medicine specialist, which is the marriage of nutrition and medicine together. I have combined my unique talents and drive to become a menopause expert. I counsel patients utilizing hormone replacement therapy, nutrition, exercise, so that they can be as healthy as possible in the future. And today I am coming on live to talk to you about perimenopause. Is it perimenopause or menopause, or could it be something else? Because a lot of the signs and symptoms of these diseases can overlap and with other medical conditions. So I want to make sure that you recognize some of the conditions associated with perimenopause and menopause, and that you know what testing should be done to rule out other conditions that it might also be. So this is the most important thing to remember. No two women are alike. We are all absolutely different, and everyone will experience perimenopause and menopause differently. 85% of us will have hot flashes, about 70% will have night sweats, about 80% of us will have sleep disturbances, up to 50% will have mood disturbances such as increasing anxiety, depression, or new onset anxiety and depression. There can also be symptoms such as gastrointestinal changes, headache changes, muscular starts being deposited in the intra-abdominal cavity, where for most of us it had never been deposited before. So if you are just joining me, welcome. So excited to have you here. I'm Dr. Mary Claire Haver, creator and founder of the Galveston Diet. Real quick, everybody take 5 seconds and double tap my face. That will like this video. That'll help me to stay relevant on this platform and to draw more, to have the algorithm show this to more people so that I can stay informing people on TikTok. So thank you very much. I really appreciate any likes that you will give. Also, if you'd like to share this video with someone you think this would be helpful for, there's a little share button right here, and also an interact button if you want to play with that guy as well. So from the beginning, we are talking about today, is it menopause or perimenopause, or is it something else? Because we have such an overlapping of conditions. So remember, you are not going to have the exact same menopause as your sister, as your cousin, as your neighbor, as any other woman in the world. Because each of us are distinct, unique individuals, and that estrogen receptors are present in almost every tissue in our body, our experiences with perimenopause and menopause are going to be vastly different from woman to woman. The age at which we go through, the severity of our symptoms, which organ systems it's affecting the most is going to change. This is where I want to exercise some caution. I want to have you not use your own experience to judge another woman and say that, well, this happened to me, therefore it should not be happening to you. This is a fallacy, the naturalistic normal fallacy that a lot of us fall into, and we start kind of being a little judgmental. And I see this a lot on my page in the comments section. Also, don't look at another woman's symptoms and feel like there's something wrong with you because you didn't have the same expression of disease that she did. So let's be very, very clear here. Number one, perimenopause and menopause is an estrogen deficiency syndrome. It is an estrogen deficiency syndrome, and it is pathologic. It is not, and it is a natural part of aging, absolutely. But it doesn't mean that it's not pathologic and it doesn't cause harm and that it's not treatable. Okay? So there is not, unfortunately, in perimenopause, there is not a simple test to determine when a woman begins perimenopause. No testing available. So you and your healthcare provider will need to do a little investigative work. And this is where a lot of healthcare providers are undertrained or underutilizing the resources that are available to them. Everybody wants easy, including healthcare providers. They want a quick test, something super easy. But unfortunately, because of the massive fluctuations in our hormone levels during perimenopause, we do not have a good, reliable test that will consistently tell you if you are perimenopausal 100% of the time. We make the diagnosis as specialists specializing in perimenopause and menopause based on the patient's symptoms and ruling out other diseases. For most women, perimenopause will begin in their 30s and 40s. Some combination of irregular periods, hot flashes, mood differences, usually are some of the first hallmarks that this has begun. But I have heard patients tell me, no, it was frozen shoulder. No, it was increasing my migraines. No, it was sudden onset of depression. No, it was a massive decrease in my libido. No, it was sudden increase in visceral fat, belly fat. I was gaining an inner tube where I never had one before. Again, all okay. All part of the process and all considered to be recognizable symptoms of perimenopause. So here's the thing to remember. Many symptoms of perimenopause are also symptoms of other serious medical conditions. So how do you know the difference? It can be really tricky. So I'm here to help you decode this stage of your life and give you talking points to talk to your physician about. Now, before I go on, I want you to know that all of this information is available at my blogs. So if you don't follow me, I invite you to become a follower of me, Dr. Mary Claire, and check out the link in my bio at the top of my TikTok page, or if you're watching this on Instagram, at the top of my Instagram page. And if you're doing this on Facebook or YouTube, just go to galvestondiet.com. That is our website. All this information is available there on our blog. Stuff that you can print out, take to your doctor to have discussion points so that you can have a better healthcare provider experience and get the care that you so desperately need. So if you have questions, drop them in the comments. I will try to get to them at the end of the talk. So to review, what is perimenopause? Perimenopause is the period of time when your ovaries produce less and less estrogen and your body begins to transition into menopause. This process takes 7 to 10 years and begins 7 to 10 years before the end of your periods, which the average age is 51, but 45 to 55 is still normal. So it's completely reasonable for a 35 to 45-year-old woman to begin to experience some of the changes associated with perimenopause. When the estrogen levels are fluctuating up and down erratically, it causes symptoms like irregular periods, hot flashes, insomnia, weight gain, increased belly fat, hair changes, memory loss, vaginal problems, bladder problems, mood shifts, sexual dysfunction, cholesterol-related changes, increased urination, and muscle and joint aches. Did I miss anything? So again, perimenopause is not easy to diagnose. It is a diagnosis of exclusion, meaning we rule out the other medical conditions to make sure we're not missing anything. So how do you know if there's no blood test? Well, we have a perimenopause quiz. It is a validated scoring system that is going to tell you the likelihood that your constellation of symptoms is related to perimenopause. Again, it's at the link in bio. If you go to Dr. Mary Claire up here, click on that link. It'll take you to the top of my TikTok page. Or if you're on Instagram, it will take you to the link in bio link where you can click there and you will see the perimenopause quiz. It's free. Go ahead and take it. It will give you, if you put in your email at the end, it'll give you a lot of information and talking points to take to your physician. So symptoms that it could be perimenopause, but might be something else. So here are the talking points. It's confusing. And if you're experiencing any of these symptoms, it's important to see your healthcare provider. So menstrual changes, having periods that are lighter or heavier or occur more frequently or less frequently than usual, is the most common symptom of perimenopause. But what else could it be? It could be illness, infection, uterine fibroids, a pregnancy complication, endometrial polyps, cervical cancer, or uterine cancer. Again, very, very important that you go to your doctor, especially a gynecologist who can rule out these other conditions. And then what's left behind is hormonal changes associated with perimenopause. Number 2, hot flashes and or hair loss. Decreases in the amount of estrogen produced by the ovaries cause hot flashes, night sweats, hair loss, and or thinning hair. What else could it be? Hot flashes and hair loss can be caused by hyperthyroidism. So, you have to have your thyroid level checked as well. Weight gain or fatigue. Declining estrogen levels contribute to weight gain, including increasing belly fat and an overall feeling of fatigue and tiredness. What else could it be? These symptoms can also be related to hypothyroidism. Again, now you need to get that thyroid checked in perimenopause. It's also the most common time that a thyroid condition is diagnosed. Body aches and joint pain. Many women in perimenopause suffer from widespread body aches, muscle aches, and pain in the joints. What else could it be? It is important to rule out other causes of arthritis, including fibromyalgia and also depression. Mood changes. Fluctuating hormone levels during perimenopause contribute to anxiety, irritability, and feelings of depression. What else could it be? Anxiety and depression may be unrelated to perimenopause, but you should have a thorough mental health evaluation. okay? This is why a lot of doctors recommend treating perimenopause symptoms with antidepressant medications, because they can help with hot flashes and they can help with some of the anxiety and depression associated with perimenopause. They're not treating the root cause, but they can be helpful, especially if you are not able to take estrogen. All right. Insomnia. Boy, this was the one that was kicking my ass. Difficulty falling asleep or staying asleep is common when you're experiencing hormonal changes. What else could it be? If you're struggling with sleep for more than a few weeks, you should be evaluated for a sleep disorder like sleep apnea. It's time to see a sleep medicine specialist, okay? Vaginal changes and sexual dysfunction. As estrogen levels decline, the vaginal tissue becomes thinner and may tear and causing pain during intercourse. Many women in perimenopause also experience a decrease in libido. Sexual dysfunction can be caused by many different factors. Remember, when we're talking about female sexual function, we have desire disorder, an arousal disorder, an orgasmic disorder, a pain disorder, and a relationship disorder. All 5 things can overlap and co-contribute to the issue. So it really takes an astute physician to help break those down. They all have different treatment options, guys. So getting to the root cause of the problem there. And not just blanket treating everyone with testosterone or libido enhancing medication, because often it is not a desire issue. It is something else going on. So now your doctor has determined it's perimenopause. Okay, they've ruled out the other causes. You've had your thyroid checked, you've had mental health evaluation, you've done all the blood testing, all the things. Definitely it's perimenopause. Now you make a decision. How do you want to pursue treatment? You can treat symptom by symptom. So if you're not a fan of hormone therapy will pretty much help everything, and also do a lot of stuff behind the scenes that you're not going to notice, like decreasing your risk of colon cancer, decreasing your risk of hypertension, decreasing your risk of diabetes, etc. Yes, it does all of that. But don't forget, I am a nutritionist. Changing your eating habits, and make sure that there's a link up here at Dr. Mary Claire. So if you're just joining, I'm going to do the question and answer part of this talk. Everybody double tap the screen. So just double tap my face. You see my finger? Double tap my face 10 times to like the video. This will help drive the algorithm and have more people watch the video. Also, you can share this video by clicking this little button right here. With you, do perimenopause and fibroid symptoms overlap? Some, yes, definitely. The irregular bleeding, heavy bleeding, irregular bleeding can be a sign of both fibroids and perimenopause. However, fibroids often have a feeling of fullness, if they're big enough, a feeling of fullness in the pelvis, or pain with intercourse, meaning deep dyspareunia, meaning pain deep. So that you don't have deep dyspareunia generally with perimenopause. So an astute clinician will be able to tease these out for you. So saddle PE, cardiac arrest survivor, birth control induced, please help bring awareness, 36-year-old non-smoker. So I'm assuming you had your clotting factors evaluated, and everyone in your family has had them. Remember, birth control just will upregulate clotting factors, and especially if you have other risk factors for blood clots. You know, someone who should not be on birth control or hormonal contraception at that level of treatment is someone who has factor V Leiden or protein C, protein S deficiency, or one of the increased clotting disorders. HRT is such a much lower dose, and for women who were on transdermal forms, there did not seem to be an increased risk of blood clots. So it's the oral forms that really are risky for blood clots, not so much the transdermal forms as well. Let's see, over 1 year post full hysterectomy, you kept your ovaries the heaviest you've ever been. Help, please. Okay, I've got a great nutrition program for you to consider. It's called the Galveston Diet. I formulated it specifically for myself when I was gaining weight in menopause, and then I shared it with my patients and then followers on social media and then the rest of the world. I've created an online program. It's very affordable. It's a one-time fee. You can check it out at Dr. Mary Claire up here. We have every kind of aid, guide, meal plan, 5 weeks of meal plan, 7 weeks of meal plans. 2 of them are vegetarian if that's your jam. We try to be inclusive of everyone. Men are invited to join, but turns out most people who listen to me are women. Go figure. So, because I'm a gynecologist. Let's see. Thank you for the roses. Hello, Jenny. That's so sweet. Oh my God, 38. Oh my God. Thank you. Is surgical menopause here? Is elevating resting heart rate and bounding heart rate normal? So if you're having palpitations or tachycardia, you need to get evaluated as soon as possible. But we are seeing increased palpitations in perimenopause and menopause. The SA node, the sinoatrial node, which controls the rate of your heart, does have estrogen receptors. And when your estrogen levels start dropping, we see a concomitant increase for some women, not all, in palpitations. So go see your cardiologist and get evaluated. Let's see, all you had to go on was your mother's experience, and it was bad. At least you had that. I mean, so many moms never talked to their daughters or had hysterectomies and just kind of, white knuckled through it. And this is time. We need to stop this pattern now. We need to start talking openly about it. We need to share as much information with our own families, siblings, friends, cousins about menopause, that it's here, it's real. There's stuff you can do about it. You don't have to suffer in silence. And just because your mother had something doesn't mean you're 100% going to have it or not going to have it. That is not the way genetics works. So remember, you're more likely to have it if your mom had it, but it's not a guarantee. And you could have things that your mother never had. So do not assume that because she never had a hot flash, you're never going to have one. A lot of great advice. You can't get rid of the chubby belly. Not bad, but you've always been skinny. Welcome to the Galveston diet. This is exactly who I made this program for. Every part of what I talk about in the Galveston diet is geared to reduce visceral and belly fat. This is a part of aging that can be worked around. If you change nothing, most of us will get belly fat and visceral fat. If you continue to eat the way you've been eating, if you follow the principles that I teach in the program, we are seeing an astounding decrease in visceral and belly fat, especially through the waist-tip ratio. Is Amberen from Walmart a good thing? There's a lot of supplements out there on the market that are being marketed to menopausal women. There are not great studies that are showing 100% of women are getting better. It's maybe 50%. There's versus placebo. It's like, nah, the studies are not great. But I do have patients who and followers who are telling me that they have felt better and had some relief. Now, again, everyone's menopausal journey, perimenopausal journey, and experience with different supplements is going to be different. And so I just tell you to err on caution. Maximize your nutrition first. Make sure you're getting the right and the proper amount of exercise, and then consider supplementation. That's always the first thing I talk about. What are my thoughts on supplements? So here are the supplements that I take. I actually made my own because I'm kind of lazy. This is omega-3 and vitamin D. I recommend these for almost about 85% of my patients are deficient in vitamin D, okay? And then omega-3 fatty acids will help balance the omega-6s, and this is a powerful antioxidant, anti-inflammatory. I make my own. I know it's purified. I know it's good. This is fish oil based, so if you're allergic to fish, you want to avoid this and go for one of the algae-based ones. This can be found at shop.galvestondiet.com. Again, link is in the bio up here. I also take collagen every day. I did it mostly for skin, but it turns out it's also, it's great for wrinkles and cellulite. I have studies to back this up. I never talk about anything without a study. This is also, turns out in the latest data, turns out that collagen is good for the prevention of osteoporosis as well. So I'm a fan. Finally, I take fiber. So a woman should be getting 25 minimum grams of fiber per day. The average woman's getting about 12. And so I push to 35 for my best health. I have some family history I'm running away from. And so this helps me hit that level. So I get about 25 grams per day in my food. And then I supplement with this to get me to the 35. So all of these are available at shop.galvestondiet.com. If you want to learn more about them, you are more than welcome to. So, and thanks for asking. I'm actually, this is my little supplement bag right here. And I am drinking my fiber and collagen. I mix them up together and I sip on them all afternoon after I break my fast. Okay, I love your wallpaper. I really feel like this wallpaper needs its own Instagram page. Literally, I cannot take credit. Look at even the chair. It's my friend who's a decorator, and I gave her carte blanche. Do you see the chandelier? It's like so fabulous. Anyway, and she even reframed all my most of my diplomas, not all. I have many more, but into white, so they look pretty in the office. Okay, enough about decor. Let's get back to medicine. Does HRT help after menopause? Yes. Yes, it does. Almost 100% of patients, not only will their quality of life get better, but their lifespan will get longer and healthier. Yes, it helps. It absolutely helps, but you need a prescription and you have to find a menopause-friendly provider for that. So if you are looking for one, again, go to our website at galvestondiet.com, or there's a link so what I did was, a good menopause provider is hard to find. We're not trained in OB-GYN. We're not routinely trained for the nuances of menopause. Or North American Menopause Society has a great certification process. So I took your recommendations, my followers' recommendations on badass, kick-ass menopause providers, had them turn in testimonials. I compiled them all, plus the North American Menopause Society docs, into a database, which is free. You just go click on the link at Dr. Mary Claire, and it will take you to, you'll see menopause referral base. So, and you can find a doc that's going to work out great for you, hopefully in your area. Again, we're adding to it all the time. If you have a great menopause provider, it's the same link. Please add them to the list. We vet and verify that they are actual physicians, but we don't but the testimonial is a testimonial. We don't mess with those. You've on hormones and you've been on for about 6 months and your inflammation is still so bad. So when we're fighting chronic inflammation, hormone therapy is only one of the tools that we use. You must be utilizing exercise, sleep, and nutrition at its fullest. So as far as the nutrition and the sleep help and the stress relief and lowering your cortisol levels, Galveston Diet is all about that. That is what we do. That is the mindset teaching, the nutrition plans, the education. It's hours and hours of education to make sure that you're going to be as healthy as possible as you age. And you can go to galvestondiet.com to go check it out. Or, oh God, look at that. We're at 14,000 likes. Everybody double tap the screen to like the video. 48 and starting to go literally insane. Didn't realize it started so long ago. You don't have to suffer. Again, nutrition, exercise, stress control, and possible hormone therapy are going to be the biggest tools in your toolbox to help reverse this process. Okay, not saying you won't need other medications, and you definitely need a workup to see if anything else is going on, but it is worth it. So if you think it might be perimenopause, again, I have tons of information in our blogs. The blog up here at Dr. Mary Claire. Click there. It will take you to the top of my TikTok page. There's a bolded link at the top. There is a plethora of quizzes, information, free meal plans, blogs, all there at your free. Go check it out and learn as much as you can so you can be an advocate for your own health. Yours is belly fat. AMH blood test is usually done for fertility purposes to see what your ovarian reserve levels are at. You're looking for a new doctor. What's the menopause certification you should look for? Very few people have chosen, but there is a certification from the North American Menopause Society, and I have listed all of those on our website. However, there's some great menopause doctors out there who are not NAM certified, so it is tough. A board-certified OB-GYN you would expect would be a great menopause provider, but no, I'm telling you, we do not receive a lot of training specific for nothing for perimenopause. And for menopause, at the time that I trained, very, very little. And I was a program director, like I was in charge of the curriculum for the trainees up until about 8 years ago. Very little formal menopause training in clinic. We learned some in the books, but very, very little. We were just doing surgery and operating and delivering babies and, doing pediatric and gen-onc and, all the, important things. I'm not knocking what I learned, but menopause just got swept to the rug. It was terrible. So really your best bet is going to be word of mouth. A positive ANA. What is a positive? So ANA is anti-nucleic antibody. So that's usually linked to lupus or other autoimmune disease. So that is an endocrine issue. And something that is a little bit, we check ANAs, but then if anyone's positive, I refer them on to specialists from there. I'm glad I just found you. Thank you. You're so welcome. I'm reading people's questions. Okay. Hello. I went to see the doctor for hormone replacement therapy. Will you need a blood test? You're needle phobic. Usually not. The diagnosis of menopause can be safely made with talking to the patient. And if you're over 45 and you haven't had a period for a year, it's almost always menopause. Waking up drenched in sweat, normal for a 45-year-old. It could be menopause, perimenopause. But it could also be hyperthyroidism. It could be several other conditions. So if you're waking up drenched in sweat and that is new, I would go to the doctor for testing. Thank you for the flowers. You have premature ovarian failure. Bless your heart. That is an awful condition. You're at much higher risk for health problems, especially cardiovascular disease. Make sure you see a specialist who's going to give you the right kind of counseling and therapy and treatment. What is the latest age for menopause? I feel like I haven't started at all. You're 53. You're still fine. So the average age is 51 to stop your periods, but 45 to 55 is still under the normal curve. I just had a patient today who didn't stop her periods till about 55. So still normal, just on the late end. You were in complete menopause at 36. That is premature ovarian failure. Bless your heart. Is it normal that you had a radical hysterectomy? That's treatment for cervical cancer, guys. An oophorectomy 5 days ago and completely symptom-free. Yes, it takes a while for the estrogen to get out of your system before you start having the big obvious symptoms. Your 1 year irregular periods missing 2 to 3 months, then twice a month. Okay, you might be in the process, but again, it's time to go see your doctor for testing. You're 46 and starting to have PACs, runs of them related to perimenopause. Absolutely, it could be, but make sure you see a cardiologist. Feeling menstrual cramps at 63, should you go to the doctor? Yes, I would. You had a hysterectomy, now suffering from liver lesions. I'm not sure what your liver lesions are from, probably not related to your hysterectomy. What if you spot all month long? Go see your doctor. This could be, like I talked about earlier in this talk, it could be polyps, it could be fibroids, it could be other things other than perimenopause, so those need to be ruled out. Running to that quiz right now. So again, if you are new to me, I have a ton of resources on our website and linked here. If you go to galvestondiet.com, just scroll down to the bottom of the page. We have medical resources, we have quizzes, we have links to our supplements, we have links to a free meal plan, we have links to our blogs. Our blogs are packed full of information, free, verified, validated information for you, talking points for your doctor. Our perimenopause quiz will email you complete guides and talking points of things that you can discuss with your physician to make sure you're the best advocate for your own care. Let's see. Thank you so much for your content. It led me to seek hormone replacement. I'm excited. Good for you. Good for you. No period in a year. If you're over 45, it might be perimenopause. Time to go get checked. Meeting with Gen Oncology tomorrow. Scared to death uterine cancer. Most uterine cancers are caught early and are very, very treatable. Those are my two pearls for you. Most, not all, but the vast majority are early stage and very treatable, and you go on with your life like nothing ever happened once you're treated. So, hugs, prayers. I'm Catholic, so to you. Thank you. I appreciate this info. Your doc said it's a personality problem. Your doctor has a personality problem, doesn't like treating women, and it's probably time to find a new doctor. That is horrible for someone to tell you that you're suffering from perimenopause and that it's a personality issue. That speaks more to the physician than it does to you. You're already diagnosed. Okay, good. Cramping 2 weeks out of the month. You're 46. Go see the doctor. You need an ultrasound. Joint pain, no periods for 3 months, then bleed for a day, increasing headaches, nausea. This sounds like perimenopause. Go take our quiz. Your right hip always hurts. I hear you, sister. One of the shocking things for me in my own menopause, even with hormone replacement therapy and a really, really good diet, has been hip and butt pain. It's shocking. And, hormone therapy goes a long way, but it's not going to get rid of everything. And I'm constantly having to rock in this chair. Yeah.
Your patient's here.
Okay. I got to get going, guys. I have a patient here ready to be seen. And so thank you so much. Everybody double tap the screen on the way out. Yeah.
Nothing. She's just a member.
Okay. She is a member. Okay. Thank you, dear. All right. Double tap the screen on the way out. Give me some likes, some love, and some shares. And we will chat again soon.